welcome to today's webinar. I'm Donna Rice, the Chief Operations Officer for Diabetes Sisters. Diabetes Sisters is the only 501c3 dedicated to providing support and education to women with diabetes and those at risk. So check out our website for all of our offerings. We offer an evidence-based peer support model that provides comprehensive education, monthly peer support groups, and resources. Our expert series of webinars are designed to provide the most updated information and education by experts in the field. So please, if you have a question before or during our webinars, please type them into the Q&A and we will definitely address them after today's talk. Today's webinar is sponsored by Sanofi, and it's the last in the series of insulin. It's titled Inspiring Journeys, Real-Life Success with Insulin. Our speaker today is Jennifer Smith, a registered dietitian and a certified diabetes care and education specialist. Jennifer holds a bachelor's degree in human nutrition and biology from the University of Wisconsin, Green Bay. She is a registered and licensed dietitian, certified diabetes care and education specialist, and an active member of the American Diabetes Association and the American Association of Diabetes Care and Education Specialists. She co-authored and published a book on management of type 1 diabetes through pregnancy titled Pregnancy with Type 1 Diabetes, Your Month-to-Month Guide to Blood Sugar Management. She's a contributing author for Diabetes Sisters, Insulin Nation, and Byram Medical Supply, and has presented at national and international conferences on a variety of topics. She also provides educational content on Juicebox podcast. Jennifer has lived with type 1 diabetes since she was a child. She's a long-distance runner, a triathlete, and a mother of 2 boys. Wow. She works as the Director of Lifestyle and Nutrition for Gary Shiner at Integrated Diabetes Services, which serves to provide in-depth, real-life education to people with diabetes around the globe. All of this has brought a deeper understanding and firsthand knowledge of the day-to-day events that affect people with diabetes. Please help me welcome Jennifer Smith.
Thank you so much. What a wonderful introduction, Donna. Thank you so much. It's my pleasure to absolutely be here and to be able to share with you a wonderful topic, which I near and dear to my heart, obviously, as somebody with type 1 diabetes. And overall, we're going to talk about successful use of insulin today. Such an important piece. I have had the chance to work with a wonderful woman who was so very willing to share her story. We say case study, but really Tina is a wonderful example of success in using insulin after a lot of different things that we'll talk through. And then, some key takeaways to using insulin essentially very successfully. So to get started, we always need to kind of have an idea of what we're going to talk through. Insulin use, who's it for? Options in technology. Our technology has expanded over the course of the past 5 or 10 years significantly. And what does this mean when we're talking about insulin use? And then again, we'll talk through Tina's story, the barriers that she really came into to achieve her goals, what her outcomes are now, very positive outcomes, and then how those are working to her need and how to make it work to your need. What are your life goals with diabetes? So when we talk about intensive insulin therapy, we're really looking at who would be appropriate. And as women with diabetes, quite honestly, anybody who has diabetes could use insulin. It depends on where you are in your journey with diabetes, whether it's type 1 diabetes diagnosed as an adult, and we call LADA, or latent autoimmune diabetes of the adult. There's type 2 diabetes, of course, gestational diabetes. All of these bring in a lot of different shifts and changes in our life that could intensify our need for insulin or could introduce the need for insulin. Perimenopause and menopause with diabetes, kind of those later years in life as hormones shift and change again. If you've been successfully managing just with lifestyle changes, modifications in nutrition and your activity level, you've been managing well, and something is shifting there and doesn't seem to be working any longer. Or if you've already been using some of the oral medications, which are very normal to use in type 2 diabetes, are they not doing their job anymore? And how do you know? How do you know how to ask for help and what to look at in order to consider or intensify your use of insulin? We also thankfully have technology, and like I said, in the past 5 or 10 years, our technology has exploded in the realm of diabetes management. And so what can we use to navigate managing with diabetes and help us to see what effort we're actually putting in? How can we intensify our management with a change in medication? Like I said, lifestyle, maybe oral meds into insulin use, or changing up the kind of insulin that you're using. Thankfully, we've got CGMs today, which alone, CGM, continuous glucose monitor, got Dexcom and Libre and Medtronic and Eversense. There are lots of options on the market, but it really gives a minute-to-minute evaluation of what we're doing in our life, food, medications, what are they doing? For those who are using injections currently, we've also got smart insulin pens now, or those who are starting to use insulin. Smart insulin pens, they add a little bit more flexibility. They are, I consider them like pumping without a pump, honestly. They connect with an app, helps you to dose appropriately, to take care of, logging everything that you're doing. A further step beyond just injections, some people really want a little bit more flexibility, and insulin pumps are that next step. They allow that flexibility, a little bit more precision in insulin delivery in terms of the doses. And a lot of people feel that it brings in a little bit more freedom and choice in your life and how you want to navigate things. And our final technology sort of bloom really is in what we call AID systems, automated insulin delivery systems. And this is the most intensive insulin therapy that we can kind of use. And it really brings together a couple of these pieces. Your insulin pump and your continuous glucose monitor talk to each other, which allows a lot more precision in insulin dosing. And it really tightens and helps you avoid the extreme ends of way too high or way too low blood sugars. Again, not that you're not doing anything to manage that, but sometimes, life happens and variables happen. And so we kind of have to move forward a little bit, with some technology that can sometimes help with that intensification and make it honestly a little bit easier to navigate through. So what do we consider in, life with diabetes then as a woman? Again, we have to consider, when might we need to start using insulin? When should we change things up? Medicine is the first thing to think of. Is what you're using right now working? How do you know whether it's working? All of the things that you're doing in your life, is your A1C, which has been long-term the hallmark of glucose management, it still only really represents an average over the past 3 months of your glucose sort of ups and downs. It doesn't really give the day-to-day fluctuations in your blood sugar, and that's where CGM technology really is so valuable at this point. If you're using a CGM and you're doing what you normally were doing, and all of a sudden something is showing excursions that are going beyond what you were normally seeing, or a lot more lows or high blood sugars, again, this is your current system working? And if it's not, and you're not yet using insulin, it may be a time to go to your medical team and say, hey, I'm noticing these changes. Let's talk about managing a little bit of a different way. Usually when we're initiating a start of insulin, we're going to start with something called a basal insulin, which is just a background insulin. It kind of lays a flat framework or a foundation to help overall coat the background with missing insulin, something your pancreas would be doing. If you are using an older basal insulin already, there are newer versions that have a lot more flat effect. So again, something that may need to be discussed with your team. Using a CGM to assist with this evaluation can be really, really valuable, because then you may be able to see, gosh, I'm doing a really great job if I'm not eating, but around meals, my goodness, I can't just eat lettuce. I have to eat normal foods, supply fuel to my body. And so this may be a place where we add or adjust, if you're already using insulin, bolus insulin, which we refer to at meal times, or we bolus to correct a high blood sugar to get it to come back down to target. And again, this is a rapid kind of insulin, a lot shorter action time period, only works for a couple of hours. It starts working pretty quickly. And really, with any of this insulin use, information and education is really key. When you're evaluating your glucose parameters, like your fasting blood sugar in the morning, or your after meal blood sugars, or you start to introduce exercise along with insulin, all of that really requires somebody that you can go to and look at records together and be able to interpret those records and be able to say, well, gosh, I started using this and now really I'm seeing a lot more shifts and changes that I like, but also some things that I'm not really excited about. So, what can we really do and how can we fit the insulin in to make sure that my life is working the way that I want it to work? So this really brings me to our case study, so to speak, Tina's story. It's really her life with a transition through many of the types of diabetes. So it kind of goes without saying, really, that women at the end of a second trimester who don't have diabetes should be tested for gestational diabetes. Diabetes of pregnancy happens with a fluctuation in hormones. But sometimes we find that this step is missed or mismanaged. And those who don't have pre-existing diabetes then know nothing about managing diabetes during pregnancy. So essentially, the following, study about Tina's story, really, who I've just had a wonderful ability to work with, and she's just a fantastic woman who wanted her story shared. Her struggles to get the care she needed, to get where her goals were with a family now and a late diagnosis with gestational diabetes. Interestingly, she had a family history of type 2 diabetes already. And so that was already there in the framework, but not necessarily for her preconception. So she was, during her first pregnancy at age of 23, diagnosed with gestational diabetes. She was diagnosed because she came to the hospital having some experience with bleeding, and she was concerned. And so at that point, they did some monitoring, some evaluations of labs, and they actually found that her blood sugar level was quite elevated. It was over 432. They did use or start to use insulin in the hospital there to manage that glucose level, and her baby was delivered shortly thereafter at that 32-week mark. Being so early, as well as having undiagnosed gestational diabetes at that point, the baby did have to spend some time in the NICU. Birth weight, interestingly, tells us a little bit of a story about what had been going on with her glucose values prior to coming to the hospital. Really, an ideal weight at about 32 weeks gestation for the infant should be somewhere around 3.5 pounds. And her daughter's birth weight at that 32-week mark was 4.5 pounds. So we can see that glucose management was already contributing to a larger gestational child than should have really been the case. Again, didn't know she had diabetes, so nothing saying there that, she could have really managed differently. After she delivered, after going home, they did the typical follow-up for evaluating glucose levels, but then no further follow-up after that because those looked clear. She was told, no worries, you just had gestational diabetes. She moved forward. Then 2 years later, at age 25, she developed gestational diabetes again in her second pregnancy, but very early. They thankfully were doing early testing because of her previous history, and she was diagnosed at 8 weeks with gestational diabetes. At that point, they did start an oral medication to assist her. It did unfortunately create problems with low blood sugar and some pretty significant stomach upset, which can be the case with metformin, but is not the typical long-term. Most people tolerate it very well. So therefore, she transitioned herself to just doing a really conservative, restricted diet and activity level that she really, controlled on a day-to-day basis. She moved into her 35th week, had been managing her blood sugars with home blood glucose monitoring, somewhere between 90 and 180. Pregnancy targets are tighter than that. They're 65 to 140, but she, again, was not using any medications, doing it completely lifestyle-wise. She noticed a decrease in her baby moving around 35 weeks. So she went in and got evaluated, and they found nothing out of the ordinary, normal heartbeat, ultrasounds and everything revealed everything looked fine. But she put her foot down and she said, no, I know something isn't quite right. I am staying in the hospital. And at that point, they started giving steroids, which are something that is helped when it helps to sort of stimulate lung development at an earlier stage, knowing that delivery may come before that typical 38 to 40 week delivery time. So she did give birth at 35 weeks. She did use insulin in the hospital there to navigate glucose management. Baby was born at a more typical or more normal gestational for that time period of pregnancy weight, but did have some lower blood sugars and a very short NICU stay compared to her first delivery time. They did again do some follow-up, as would be expected in the aftermath of gestational diabetes. Glucose levels returned to normal, which could be normal following the postpartum time period washout of typical pregnancy hormones, no longer impacting blood sugar and overall lactation hormones. She was able to nurse, which is fantastic for her health as well as the baby's health. Very likely also led to more normalized glucose levels. And so no further follow-up or medication was really, provided for her at that point, because everything was really looking like it was supposed to look at that stage post-delivery. So what then sort of happened? We know that she wouldn't be in the story if she didn't end up having to use insulin at some point. And overall, in the postpartum years between about 2015 and 2020, so fairly recently, she actually started to notice herself increased symptoms, fatigue. Nothing could really, make her feel like she had had a good night's sleep, skin breakout problems, digestive issues, just an overall sense of some memory issues and things that she had the brain fog. She was diagnosed then with hypothyroid or underactive thyroid. And that was in 2020. Doctor helped to get her started on an oral medication to assist with the thyroid management. She was still gaining weight, interestingly, but some of the symptoms started to go away with the thyroid med. So she kind of checked one thing off the box, but knew something was still wrong. Like many people, was vaccinated in 2021, after which she had a very quick progression of increase in thirst. She got out of her old blood glucose meter from when she had tested in pregnancy and found that her glucose was very elevated in the 300s. Her A1C at the time with lab testing showed to be 11%. She went back to the doctor with these results, really kind of knocking on the door and saying, something is wrong. I know, look at these results. The doctor again prescribed metformin and provided a little bit of minor dietary recommendation, which at that point, she really didn't have much more to cut out. She was being as restrictive as possible already. She did trial the medication of metformin for about 6 months, but really just could not tolerate it very well and didn't seem to be doing very much beneficially for her. She followed up with yet another functional medicine doctor in 2022. This doctor thankfully started to do some testing, found that she had low insulin levels. Insulin was not prescribed at this point, however. She was formally diagnosed with type 2 diabetes, however, and prescribed some new medications, which did seem to assist with some things at that point, brought A1C down to about 8%. But what she really found was a continuation of these mental health types of things. She just knew something was not right yet. There was still more that needed to be done. And she felt she was doing so much in her lifestyle change. She didn't know what else she could possibly do. And, she I quote here, I had developed a severe memory loss, blurred vision. She was anxious and depressed, and she was starting to fear actually eating food because of what it was going to do to her blood glucose levels. I'm going to share a short little clip that thankfully Tina was willing so graciously to provide. So I'm going to stop sharing here for just a minute so that I can bring up her wonderful clip and go back to sharing here and play this for all of you.
I was constantly depressed. I was constantly anxious. And the day I got insulin, my depression went away. The day I got insulin, my anxiety went away. My joint pains went away. My skin started clearing up. Um, my memory issues, I still have memory issues, funny enough, a year later, but it's not as bad, you know?
Okay.
But I'm obviously not Tina that I was back in varsity or, if prior having the
Before.
kids, if you
Sure.
understand what I mean. But at least I can get through a day. I had gotten to a point where I could not get through the day with work. I would have to work and take time out. I would literally come back home because I work close to the house, come back home, sit on the floor, switch on meditation music and just shut down because it just coping with my day-to-day duties or tasks was almost impossible. And
Along with
that's
the
what
pain and the
Insulin did.
inflammation that your body was living in, you couldn't work
Definitely.
through everything.
I was not coping. I could not. My kids also would constantly complain. They'd say, Mom, you're just always tired. You're always sick. We no longer go out as much. We no longer have fun. And that's what I was. I'd say to them sometimes, oh, let's ask how are you? I'd be like, I'm fine. They're like, you don't look fine. And you can imagine at the time, these are little 5-year-olds, 6-year-olds. And I was just feeling terrible because like my little kids are waking up, they growing up with a sickly mother. And I was very, very much able prior to me feeling this sick. Do you understand? But yeah, I'm just grateful. Insulin has even my mental wellness. I'm happier again. So I just thought maybe I was just a pessimist. Everything was just so hard to do.
All right, so stop sharing for just a minute and bring back our presentation and keep kind of moving on with where she finally has gotten to today. So she did have a very long road to diagnosis. Again, as we move forward into real diagnosis, her weight gain that she had been working so hard on managing suddenly turned to a weight loss around 2022. And she was losing enough weight without changing much lifestyle wise that she went into another new medical provider who did finally do some antibody testing. The interesting thing of the antibody testing, with knowing now that she was LADA, or latent autoimmune diabetes of the adult, a very slow developing form of type 1 in adulthood, this provider did keep her on oral meds. A1C was still around 8%, interestingly. Sharing her story and frustrations with a friend at the gym, the friend connected her with another friend whose story sounded very similar, and she thankfully got connected with her current wonderful provider, Dr. Diab, who is a diabetes specialist. Dr. Diab essentially said one of the first things to her, looking at all of her information, was, why are you not on insulin? And so about a year ago, in June of 2023, she finally was able to start on a basal insulin. And as you heard her say, she almost instantly started to feel much better because, again, her cells that had been so starved for actually getting the glucose in to fuel everything that she needed to be doing on a day-to-day basis, there was finally something there supplying that. We started working together. She's been such a wonderful person to work with, and started some mealtime insulin, along with a lot of the education that comes along with using 2 types of insulin and to navigate that well. We moved into using, in this past fall, CGM, so that we could track her data and evaluate and be able to see, gosh, when I do this, when I take this medicine, this insulin with my meal times, I can see how to time it better. I can see what foods actually work better for me, what activity does. Her A1C down to the 6% range. And now we're continuing to work on her weight gain, since she had lost so much weight during her time period prior to actual diagnosis with LADA. And show another little short clip here for you all so that you can actually hear how insulin really sort of transformed her care. Share this. And so not until you were finally on insulin, which you've been on about a year now, is that right?
Yes, it's been a year and 1 month.
Okay, and you tell me the difference, like A1C numbers, you're using a CGM, so like now you're fully, like you are definitely intensive management at this point, right? And so, I mean, what's the turnaround? What's the best thing that you can say about starting insulin? How has it kind of transformed things for you?
Okay, I'll first answer the A1C. So my A1C moved from like 11 point something all the way to 6. So that is a huge difference.
Oh, that's
Yes.
amazing.
It's a huge difference. I definitely feel it. I feel better. I know a lot of people when they're diagnosed with type 1 diabetes, they like stressed out and, depressed about it. For me, it was the answer I was looking for all these years. I just wanted someone to let me know what was going on. So it was definitely a life changer for me. It was a life support type of situation because I didn't have to now try and figure out what was going on. So it would, insulin literally brought my life back because it was as if I was feeling my life seep out of my body.
Okay. You can tell how much of a difference this really made for Tina. And, again, intensifying management if you're already using insulin, and or if you're thinking about moving to it and your doctor has been bringing it up. When we start to use insulin, technology can be a huge benefit at this stage in the game. We've got wonderful technology. As I said, Tina uses a continuous glucose monitor. She uses the Libre system. You can see here how much time she's spending in range now, thankfully, what her average glucose levels are. Overall, we're looking at a CGM trend line here for when she takes an injection of insulin, and she can log what she's done in her day, meals and activity level. She can see the impact of all of this. So bringing that sort of full circle picture back, yes, you may need to start using insulin or intensify your use of it, change it up a bit, but technology can be a really good friend in learning how that works for you, to be your best person, right? As I said, individualization is really the key. And to get individualization, you really need to work with somebody. Education at each of these steps of moving through management strategies, medication, and everything. When you start using insulin, you need somebody who really can teach you the best use of it. There are some new meds that can be used along with insulin, whether you're type 1, type 2, GLP-1s, the metformin, which I mentioned, SGLT2s, all have really good purpose. Again, working with a really good educator or clinical team can help see where these might fit into the picture for you. We've obviously got, technology to assist with your strategizing, lifestyle changes, and you can see how much of a mental shift Tina got out of just being able to see that she wasn't crazy about how she was feeling. She really needed the use of insulin in order to move forward with her goals as a mom and a professional, and everything. And I think the biggest thing that I see that she did was she kept asking, she kept advocating for herself and kept moving through different clinicians to get what she needed to get. So I'm going to share just a short little stop this video here and move to her last little clip, which I think is so valuable to hear how she feels about things at this point. So you're saying that insulin was a life changer for you?
A life changer. I feel like myself once again. Not 100%, but I mean, it took so many years for the damage to be done. It should surely take a little bit more time to get back to what I would say normal. But
Absolutely.
I feel like my normal self again. My family's happy now. I have a happy husband, happy kids, and happy colleagues. I can be my self.
You can be your best self, can't you? Yeah.
I can definitely be my best self. So it's not just for you too. It's also about what about the people around you?
Yeah.
You
right.
know?
Absolutely. And sometimes the people around you may also be trying to help you too. They may be saying, well, hey, what about this or what about that? And sometimes with higher glucose values, sometimes you're not as able to receive that information because you're feeling so poorly that you just you don't think anybody else understands. So it's really important to get on the type of therapy, medication, and again, clinical support that you need. And if who you're seeing right now isn't working for you, it's absolutely in your best interest to seek out another clinical team, as you did, in order to get what you need. So as you can see, she definitely went through a lot of different members of clinical team in order to get to where she needed to get to. And thankfully, you know, I had a chance to work really closely with her at that really critical time of navigating through insulin start and everything that she shifted and changed. And she's just been a delight. So I hope that this has helped you to find, you know, maybe a way to seeing insulin as a success, and or to consider talking to your providers about it if it's something that's kind of been on your mind in terms of helping your management and get to your goals. So thank you so very much.
Thank you, Jennifer. What a great presentation and what a great person. I mean, I really want to thank Tina also for being able to be very candid and talk about her diabetes, and for you, Jenny, to be able to like counsel her and really help her through some of those moments where you think, oh my goodness, what's happening? So it's a really great presentation. And I think just a couple of tidbits here. Number one, it's just being an advocate for yourself. And I think you really hit the nail on the head when you said that, Jenny, and how as individuals living with any chronic disease or whatever, it's so important to be an advocate for yourself and to seek out the right providers and the right people to really help you kind of manage your disease. So it was a great presentation. And again, thank you. I see that we do have a few questions from our audience, and I am going to bring the questions up. So the first question is from an anonymous sender. I believe the person started on insulin a few months ago and is getting fatter and fatter, though not gaining a lot of weight. I walk a lot and do resistance training. What else can I do? I can't stand my new fat body. Oh boy. Yeah.
Yeah, and that's, you know, in terms of evaluating a why, could be if insulin was recently started or intensified potentially. It may depend on where glucose levels were prior to. So maybe if glucose levels now are more where you would like them to be, but weight gain has kind of moved into the picture, it could be because before your cells were kind of being starved, right? Insulin is, whether your body's beta cells in your pancreas make it, or we inject it or pump it, insulin is a storage hormone. That's its job. So it is a really fine kind of balancing act when we start to have to, for lack of a better way to say it, think like a pancreas, Gary's famous book, right? When we have to start to think like our own beta cells would be doing, there's a little bit of a mismatch sometimes. So again, working with an educator, if you're not already, may really bring some of those pieces together and find a way that you can navigate maybe your nutrition. Maybe there's some shifts or changes to make there. Maybe even your activity strategy. There may be some things that are better for you to try to do in terms of weight management to bring on more muscle gain, more muscle, which sensitizes to insulin and can bring your insulin doses down some degree. And like I mentioned at the very end, which I didn't have time to really go into, there are some newer medications certainly on the market that definitely do help with a lot of different things: insulin sensitization, weight management, satiety or appetite navigation. So, you know, some of those may be things to bring to your team to discuss as well. You know, without a full picture, that's kind of the tip of the iceberg that I can kind of give.
Okie doke. And thank you, Jenny. The next question comes from an anonymous attendee as well. I really appreciate that you included smart pens in your presentation. Having different management options is so important. I used a pump for over 20 years, but transitioned to MDI, multiple daily injection, due to absorption issues and severe skin irritation. My endo recommended the InPen, and it has been an awesome way to keep tight time in range without a pump.
That's awesome. Yay. I know. I wish that the InPen, really, it's kind of one of the only ones truly on the market. It does such a wonderful job. It really is it's like pumping without a pump. There's no tubing, there's no adhesive, but the app that it works with really does the calculations for you. It helps to keep track of records. It's a wonderful tool. So thank you for sharing that, because I think it's an underused tool for those who either choose to do MDI or, like you said, kind of needed to go back to it just from site absorption issues with pumping. So
very good. Okay, this next question comes from Carly. My journey with diabetes mirrors Tina's closely. One question, you made a point of putting her COVID vaccine on the timeline of her diagnosis journey. Mine happened the same way. Had vaccine and then got LADA diagnosed. Are you thinking there's a connection in some way?
there's not a study. I wanted to present, exactly how her diagnosis story went. We don't have enough data at this point to really support that connection. I think there's enough anecdotal information from enough people to suggest that there might be some type of a connection. But again, person to person, just like we don't really know what causes true autoimmune diabetes in anybody, we can't really say why some people may be more susceptible and others may have no issue whatsoever, right? I've also heard beyond Tina, I've heard other number of people who've had very similar kind of stories as well. And I'm sorry that that was a turnaround point for you in terms of diagnosis, but I hope that you're doing well with everything. And if not, reach out for some education.
Very good. And the last question comes from Karen. How does someone work with you, Jennifer?
Oh, well, you can find all about our whole practice. Integrated Diabetes Services is integrateddiabetes.com or info@integrateddiabetes.com. You can send an inquiry letter there to just ask about how our services work. Essentially, we work with people all over the world, as you can see with Tina, and are able to work remotely, which is very nice. So a lot of our visits are actually via Zoom or phone call or Google Meetup, any of those types of things. And we work with people either one-time visit to kind of get you rolling with answering what needs to be taken care of, or kind of ongoing visits. We call them retainers. So you can kind of get a little hand holding over a defined period of time to really kind of tag things in and get to where you want to go.
Very good. Okay, I think we are pretty much out of time. So I just want to thank all of you for your questions, and thank you, Jennifer, for a wonderful presentation. And thanks again to our sponsor, Sanofi. And to complement our insulin series, we've created 2 great tip sheets that's available for download. So one is on insulin and the different types of insulin and their action and peak and duration. And the other, of course, is on hypoglycemia, because we know that you can't talk about insulin without really addressing hypoglycemia as well. So
That's
some
very
of our
nice of you to include both of those together. That's an A+. That's awesome.
Thank you. Thank you. Again, a big thank you to Jennifer and our sponsor, Sanofi, and thank you all for joining, and we hope to see you in August. Have a great rest of the day. Bye-bye.